Everybody got a copy of the agenda? And that door there. Any additions or deletions? Got motion to approve the agenda? Brad, second? Randy, any discussion? All in favor say aye.
Aye.
Everybody should have a copy of the minutes of the previous meeting. Anybody got any comment or additions? Not, need a motion to approve?
So moved.
Happy second?
Second.
Waller, down front. All in favor, say aye.
Aye.
Okay, next on the agenda is the treasury report.
All right. As of the 3rd of this month, we have in Young Mothers $1,580, in Life Center $1,647, in Domestic Violence $504.48, Forum $2,841.30, County $7,907.93, Substance Abuse and Addiction $4,411.20, which breaks down to the CDF grant of $720.52 and the RX grant of $3,690.68 for a total across all funds $18,891.91.
Any questions? Not motion to approve the agenda, treasury report. Second?
Second.
Happy or Brad? All in favor say aye.
Aye.
Okay. Old business, community resource guide.
So Kathy, I don't know where she went, is she in here? Oh, there she is. We have finalized it. She worked with Jody, I believe, to update it. She did all the checking of the phone numbers, and it is printed for you to take today, but I will follow up with an email to everyone with an attachment so you can print as you need.
And there were a lot of changes.
There were a lot of changes, thank you, Kathy. And so the goal is to do it on odd years, so every other year. Next time it would be due would be in 2025 for updates.
Adopt a family. We've got that.
Okay, I guess we don't have Crystal here.
No, she's right there.
Oh, there you are. Okay, yeah, go ahead and update. Sorry.
As of this morning, we have 75 kids signed up, which equals out to 30 families. I met with Officer Finch this morning, who is doing a shop with a cop, and it currently looks like he has 160 kids on his list. We kind of cross-matched them. There was a few signed up twice, so we took those off. But he has like 35 to 40 kids that he cannot like fulfill their needs right now. So I was kind of hoping to see if we can pick some of those up.
Okay. So
I didn't know how much more wiggle room we had.
it's gonna come down to donors, and what's going to probably end up happening is we'll match those that are our traditional applicants,
Yep.
with our donors. And what happens is that people don't think about, signing up to be a donor until it's closer to Christmas. So I think we're gonna pick up a lot of folks that are gonna still be interested in, being a donor, but we would have matched all the children, and then we can then open up the opportunity then.
Okay.
For those additional children in need, in partnership with the Sheriff's Shop with a Cop program, we'll see if he prefers for us to just collect funds or have people make donations of certain types of items, because I think that's what they did before.
They do $100 for each kid.
Yeah, we do about 75 to 100 is what we recommend as well. So I think we're gonna have to feel that out as we get closer and we get more donors than we have for the regular families. So, okay. Okay, we'll work on that. I guess the final update to the forum will be in January, since we don't meet in December, but, we'll work it out amongst those that agreed to, facilitate the program this year, which is the MU Extension County Council and the Health Department, and then, we're having the gifts distributed here through the community center.
Any other questions? All prescription, take back. We did, Happy and I was at the firehouse, and who was that?
Yeah, Bloomsdale Medical Center with Bill Kramer, Robert Scott with the AEL program, Lee Beard with, Department of Health and Senior Services. So, I stopped by as well, and we had the sheriff out there as well. Barton, I think his last name. What is it?
Mike Martin.
Yeah.
We had Sergeant Ryan and Tatum, but we took in 40 guns?
Yeah.
Right,
But the
40
total was like
pounds, yeah.
68.
I think the total was 61. So it was 22, almost 23 pounds in Bloomsdale, and I believe you guys were at 28, 31, 32?
We were 30 something.
Here, let me look. Anyways, it was 61 pounds total. I can't quite think of, the exact numbers. In Bloomsdale. No, 38 pounds in town at the firehouse, 23 pounds in Bloomsdale at the pharmacy.
So, but you can see it, every time it's in that 60, 70 pound range.
Ever since, can I throw something in?
Oh, yeah.
Ever since we got our drop box at the health department, which we got at May 31st, so starting in June, we've had it emptied twice. I should have him weigh that. I don't have any idea what it is. It's probably not.
You should weigh it and track it.
Yeah.
Cause that could be something that's reportable to, SEMO Resource Prevention Center, cause those are the things they want to hear that come out of that. I also sent a story to the paper through Happy, and, I made sure to mention that there was 2 permanent drop boxes at the health department and then at the sheriff's department. In there.
To wait next time.
Okay. Any other old business? Anybody want to bring up? If not, new business, membership to CASA?
I don't know, how do you say that?
Missouri Coalition Against Domestic and Sexual Violence. I know, I wish there was a shorter way to say it. First I wanted to say that I went to the sexual assault summit that was in Jeff City, and it was really good. I went the 10th, 11th, and 12th of October. And on their website, you can get this, you can email to get this short sexual assault poster, and they also have these, and these are free. This bigger one, this comes with like 14 different ones. I'm gonna send them around, you can see them. And I'm proposing that the forum here become an affiliate member. I'm sending around paper that says what you'd get, and mostly it would be for information that you get. Let's see, basically you get on-site, regional, and through the internet education. You get the trainings through their portal. Let's see, you get technical assistance where they would talk with you one-on-one, and they give you updates on state and federal legislation changes. You get reduced pricing on the publications and manuals, which I've gotten all of mine free. And then they have regional meetings and conferences too that you can do through the internet. This is their new laws in Missouri. I'm going to pass it around. The most important part about this is in the back. When you get a domestic violence victim, it costs $15 for a birth certificate, which often they don't have any money. And any volunteer, employee, or agent that would see a domestic violence victim can fill this form out. and they would get it for free. So I'm gonna send this around. And the reason we're presenting this to the forum is anyone who deals with a domestic violence victim, which 1 in 3 women or 1 in 4, there's a discrepancy there, they argue, will see domestic violence, severe domestic violence in their lifetime, and 1 in 7 men. So it is seen out there. So if you deal with that, it would help to have education in that. And the conferences are very good. I just went, like I said, to the sexual assault one. That was very informative, and I made contacts through other agencies too. I met with the Catherine Veneer, and she's the head prosecutor in the state, and she got me in contact with different conferences that they offer, and I shared that with our law enforcement. So you make other contacts, kind of like what we do here in Network. The different laws cover things like housing, jobs, education, and health, government programs and things like that. So it costs $300 a year, and that would be for everybody, you know, that's in this forum would be covered. So $300 is not that much. And there's no responsibility, you don't have to do anything other than you could access the forum and all the education. They have a lot of different, you know, topics and things that you could have access to. So, and then they have emails that cover so many different topics, and also grants. I've sent Australia a lot of things that I thought she would benefit from that she's like, that I've sent her. And it, like I said, it covers all different topics. And the booklet will show. I'm getting more booklets. They didn't arrive on time, but I'll have more booklets for the January meeting.
Okay, so Kathy's been doing this domestic violence work now for several years. How many years would you say?
6 years.
So I think we're at a point where Kathy, as a representative of the forum, has established herself pretty well in what she does. So we think it would be valuable to go ahead and follow through with this membership because she's not going to stop doing it, I don't believe, anytime soon. And this would be direct to her as opposed to her trying to associate with other organizations. This would put her direct to these training opportunities and information that she needs to have as she continues being an advocate for victims of domestic violence and safety.
And all of you would have the same access to it. And as far as what I do, I am not a shelter or an entity of myself. I am, like, I call myself a traffic cop. I direct people first to professionals, counselors, the shelters and things like that, and then I offer support. But first I direct to professionals, you know, and I have 8 years experience down at the Safe House in Cape is where I get my knowledge from, is from experience and things like that. So that's what I bring to the table, and I'm just like a traffic cop where I just direct and I have experience. And, you know, I'm not a professional. I offer peer support. But I am not a shelter. I'm not certified in any type of thing like that.
Yeah. So the value here would be for her to maintain as informed and aware of all of the things that are going on, because there is legislation involved in advocacy for victims of domestic violence and all the laws and litigation that surrounds that issue with it being a criminal, you know, related to criminal activity essentially. Yeah. So she is asking for us to approve that membership. She has funds in her domestic violence, what do we call that, line item. So Kathy, do you want to let them know what the cost would be?
It would be $300. I'm sending around a paper that kind of highlights more of what's on it. With the emails, they do send out, not a lot of emails, but you can opt out of any topic that you don't like that they're sending you. You can opt out of a single topic or all the topics, but the topics are what give you what's going on currently. But they do have the vault of information that you can get on and pick out certain things. They have YouTube that anybody can get on their YouTube stuff, but their vault is specific, you know, and more informative, more of a professional level information.
Do we need a motion?
And then just so we think about sustainability, because $300 a year it will add up eventually, and we only have how much do you have left in your?
She has $504.48.
So she has $500 left, but we believe that through that membership, there will be grant opportunities for her to sign up and kind of help meet that need of funds long-term.
Yeah, it'll put me where I can apply for funding. Right now, I'm just a person. But if the forum joins, then I can apply for grants and things like that. So even though it's a $300 investment, I could get grant money that will more than cover the $300.
And really, we're just gonna see how this works
Yeah.
for a year, since she has the funds, there, and just see how it works out being a member.
Okay, so, we have a motion to let Kathy use fund join the membership.
I motion.
Jenny?
Second.
Second. Any discussion? Not, favor say aye.
Aye.
Any nays? Pass. Okay, thank you, Kathy.
Thank you.
Okay, next is the doctor here.
Good afternoon. My name is Dr. Steve Potler. I'm Chief Executive Officer of St. Genevieve County Memorial Hospital. We've been talking about a community health assessment and plan for a while, and it's an exercise we've gone through a couple of times at the hospital. And I wanted to walk you through what it looks like and what we've done on previous plans a little bit. Just a little bit about my, I'm going to take about 20 minutes. I'm going to try and stick to that because I know how much there is to do in the rest of the meeting here today. A little bit about my background. I grew up on a farm in Ellis Grove, about 15 miles from here, and traveled a lot of places, but I spent 10 years in direct bedside nursing, and the next 30 in administration. I picked up a bachelor's in nursing from St. Louis U, master's in health administration from Wash U, and a doctorate in biomedical ethics from a medical school in New York, which came in really handy when we were trying to decide if you have one ventilator and 2 patients who are going to die without it, how do you decide? And so when COVID came along, that was, I felt prepared for the moment, but it's still pretty daunting to have to make those kind of decisions. So that's where the doctor part comes from. So wanted to give you an update. I want to start with our mission. We put people first by providing excellent, personalized, and compassionate health care, and that's something our board goes through every time we meet. And it's something that we take very seriously in all our decision making. And I usually start out my presentations with just recognizing that. Then when we look at what is health, I want to walk you through a couple of different things here. But what is health? And according to the World Health Organization's, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So for me, as a hospital administrator, health is not what happens in my building. It's what happens in everyday life, and I get to be a very small part of it. And if we do our work well, people are going to have long, healthy lives in our county, and that's really how we want to be oriented, is towards promoting health as opposed to only treating disease. So to that end, when we talk about a community health assessment and a plan, we look at different areas, and usually the plan starts out with looking at the demographics, what's happening in your area, what's the health data, social determinants of health, and I'm going to talk about current initiatives and things that we've done with our last plan, and then opportunities that we have going forward. And the handout I passed around is really specifically about the hospital. I was looking back, and I can't find a previous description of what our hospital does and where we're going that's been reported out to the community quite this way. And so I'm trying to get this information out in the handout today to people so they know what's going on at the hospital, because we ask for support, we ask for you to use us, and we think we owe you a little bit of information about what it is we're doing. So when you look, that idea of what happens at the hospital is only a small part of health. And I'm going to go through these slides way too fast, and I can send them out to anybody who wants them, but just kind of a warning there. So when you look at what goes into a healthy person in a healthy community, there are people who figured out how much of each category of an environment contributes to health. So physical environment is about 10%, so air and water quality, housing and transit, social and economic factors like education, employment, income, family and social support. Healthy behaviors is 30%. Clinical care is only about 20%, so access to care and quality to care is only about 20% of what makes people healthy. And so in that regard, we have to look at way beyond just do we have access to the medications and do we have local physicians. So the idea behind community planning is that all these different elements, so you have hospitals and clinics, but mental health, schools, government, business, social services, public health, housing, long-term care, and faith-based organizations. And that's what we've been incorporating in previous plans, and that's what I think we need to keep doing. And this is a perfect forum for having that discussion and making sure that we all stay on track as a community. And I think y'all have been doing that very well and for 30 years now, which is really outstanding. There aren't a lot of places that can do that. This is not intended to be an eye chart, but when you look at the demographics of our community, we are rural, no kidding. About 76% of people in this county live in a rural environment. We have a higher percentage of disabled compared to the state and national averages, and we have a higher percentage of people 65 plus. None of this is unusual for rural communities. So we're living through the same things that just about every other rural community is. The good news is that when you look at health factors, so the things that contribute to health other than just access to care, when you look at St. Genevieve, we are in that top quartile of all counties in Missouri. You look at the counties around us, and it's well known that there are a lot of different health challenges in these communities. St. Genevieve County has fared very well in terms of health factors. What kind of a living environment do we have in our county? When you look at health outcomes, how healthy are people in this environment? St. Genevieve County is in the top 25 and has been for a very long time. St. Genevieve and Perry County are very tied together in a lot of ways, economically, families, work environment, and so we're kind of an outlier in a good way compared with the health outcomes in all these other counties around us. And then we've talked a lot about drug overdose and usage here, and even though we take it very seriously and we're trying to reduce that, we still fare very well, one of the best counties in the state, but when you look around us at our neighbors, they're in that bottom performing quintile of most vulnerable. So we have a lot of people who are traveling through that we may have friends and neighbors in these counties that are vulnerable, and it's easy to have it cross that line, and so diligence is going to be necessary to help manage those risks. Once again, this is going to be a little bit of an eye chart for the folks in back. When you look at it, things like life expectancy, we fare better than Missouri in the US. So we tend to live longer here. We tend to have lower amounts of premature death than Missouri and the US. When you look at other information, things like alcohol impaired driving deaths, we don't fare as well. So nearly double the rates of Missouri and the US on a per thousand basis. So that is a significant risk. And some of these are self-reported, like cigarette smoking. So I'll say a little exercise I go through is when I pull up to a stop sign, I look at the person across the stop sign from me, and I look to see if they're smoking. And I think it's more than 20%, which is what is self-reported. I think it's a little more than 20% when I see smoking across the stop sign from me. So there are things, and then drug overdose deaths on a per thousand basis. It is a little bit higher than Missouri overall and higher than the US, even though when we look at the neighboring counties, we fare pretty well. When you look at primary care physicians, and some of this stuff is in the report you got, the report that Australia printed out is the actual text of the most recent report. Some of these are updated from that in this spreadsheet here. We have about half as many physicians in this county as Missouri as a total does, and the US does as a whole. Physicians tend not to locate in rural communities because they like to stay close to where they train generally. They stay in big cities, and they tend to stay within 100 miles of where they train when you look at it. And so when you look at this report, when you look at, we recruited 8 positions in the last 2 years, that's extraordinary. And I think that's a testament to what this community offers in general, and we're very fortunate in that regard. When you look at other things, these are some other demographics like high school graduation. That's a huge factor in our favor, 93% compared with 91% in Missouri and 87% in the US. That's a big indicator of how you're gonna fare beyond that. So median household income, I'll be honest, I've been having trouble getting grants because our median household income is too high. So good news, bad news. Good news for everybody here with a higher than a median household income for the rest of Missouri, a little tough, and we're trying to do things that are going to push us farther down that chain. And then we look at motor vehicle crashes. We do have motor vehicle crash deaths. We do fare unfavorably compared with others, and some of that is like rural areas in general, when you have those alcohol impairment deaths, when you have longer drives to work, if people work out of the county, those are all things that are typical in a rural area. I'm going to put a little bit of a plug in for the hospital, because rural hospitals are uniquely at risk because the population tends to be older, sicker, have lower economic status, less ability to pay, and it's harder to recruit physicians to smaller facilities. So when you look at all these dots on the map, including some that aren't too far from us, about 183, and that's closer to 200 now, I need to update that, rural hospital closures since January of 2005. And so we're unique in that perspective, but we're still able to make it on our own because of the support from the community. What happens when a small hospital closes? You lose access to emergency and inpatient care. You lose providers that depend on an acute care hospital. Lots of the physicians who work here would not work here if they didn't have ready access to our radiology, our lab, and the emergency department to take care of their patients. And then the direct cost, there's a loss of jobs from the largest employer, loss of taxes paid by the employees, and then loss of jobs and revenue if the businesses leave. And you see with our employees, that's $68 million of revenue that comes in, about $30 million worth of salaries that go through. That's a lot of funds that go through the community. And when you shut down a key service, it's difficult. When I went to Murfreesboro, they had recently shut down their OB unit, and there was just a loss of trust in the hospital in that community. And it's something that's hard to recover from, and people start looking elsewhere for everything else they need in life. That's why we're working hard, and we recruited 2 new OBs and brought them into town, and they're really taking off well. So we're doing what we can to make this hospital viable, to keep the community healthy, and to be a good business partner as well. When you look at the specialties we have, on the medicine side, we have hospitalists and emergency physicians in the hospital 24 hours a day now. In the clinics, we have family practice, internal medicine, pediatrics, cardiology, and we just recruited a second psychiatric nurse practitioner to work at Point Base along with an LCSW. They are very hard to get a hold of. But this is a list of specialties that are here in the hospital that are on a regular basis that's hard to come by in other small hospitals. Frankly, we have as much or more urology as Festus does, so I'll brag on that. But we have visiting specialists in cancer and hematology, pulmonology, rheumatology, nephrology, infectious disease. We have a visiting physician for that. We have a new general surgeon. I mentioned the new OB. So we're adding these specialties that are key to the basic services you want in a hospital. And when you look at the financial effects, 365 FTEs, about 500 employees total, about 20 full-time physicians, 25 nurse practitioners, county tax support at just over $1 million a year. So almost 60 years ago, the county said that yes, we'll tax ourselves so that we can have a hospital. and almost 55 years ago, the hospital opened. So that's a big commitment on the part of the county residents, and we want to honor that and hold up our share of it. Foundation support of $280,000 last year, so fundraising was a big support for us. Mentioned the salaries and the net revenue. And Medicare is about 52% of our net revenue. So when you look at when Medicare payment changes, it affects us in a huge way. And so Medicare is adding 10,000 people a day to the Medicare rolls, and they're committed to lowering how much they pay overall for the program for over $100 billion a year by 2030. Guess where it's going to come from? They're not going to reduce benefits. They're going to take it out of hospitals and physicians, and they're coming up with new ways every week. So that is one of the reasons why small hospitals close. And I mentioned some of this. When you look at it, we are, I think St. Francis is unaffiliated in Cape Girardeau, and we are the only other unaffiliated hospital south of St. Louis, or from St. Louis south in eastern Missouri. So we are unique in a good way that the board plans on maintaining. When we look at the community assessment process, going beyond just hospital care, we generally gather, usually there's a facilitator of some part, someone who can help manage a group of a certain size. If you get 20 people in the room, usually decision makers, usually highly opinionated folks, and let's do this, no, let's do that. Well, do we have the time to do this? Do we have the volunteers? Do we have the money? So usually the group gets together and gathers any other information. So you start with the demographic information I started with, and you say, okay, what else do you know about that we should include as we look at how we improve the health of the community? Evaluation of strengths, weaknesses, opportunities, and threats, establishing priorities, a plan for interventions, and then outcomes and adjustments to the plan. So I just detailed in about 90 seconds what can take a couple days, or a couple hours, a couple days, a few weeks, or maybe a month or two, depending on how the group gels together and how coherent the sets of priorities are. We've been doing this process for a few years now, and as the hospital, we are trying to take a different look at the community of not just what's in the walls of the hospital, but how we keep the community healthy. And we're looking for things like which things do we own, when do we partner, and when do we advocate? Because there's some things that we don't have the reach to say we're going to do this or we're going to do this with you, but can you help make sure that these kinds of things happen? And I'll give you some examples here. With us, the things that we're owning and coordinating with include a food as medicine program. We're trying to take people who are at high risk of developing from pre-diabetes to diabetes and helping them learn how to cook and live differently so that they don't need medicine. They don't need to do the other things you do when you go into diabetes. Parish nursing, we're trying to work with local congregations to help make connections to people who may be vulnerable or at risk or may not know what resources there are locally. Access to resources, and of course opioid prevention, treatment, and long-term recovery support for folks with substance use disorder. Other things like partnering with the National Health Service, and this was one of the tools they used when we were trying to come up with how do we do this if we work, where should the plan go if we're going to have a more walkable community. So that's an example of one of the tools we came up with there, and then getting community input on some of the trail plans. And I know this is something that's continuing to develop, but this is something that we partnered with folks on. And then coming up with some of these opportunities and some of the priorities is what happens when you get in these groups and you continue to work through the process. And we agreed on 3 main areas last time, including safe places to walk, the handbook that we just talked about, and then wellness and prevention services. So it went over a variety of things, and if we went through this exercise as a community services forum, we'd come up with different priorities because things have changed since we did it. I talked about the food as medicine program, where we actually, don't look at the Lay's potato chips, but teaching people how to walk through a grocery store, the outside where all the healthy stuff is, and then how to cook it, and then prescribing 3 vegetables and 2 fruits on a weekly basis after we teach them how to use it. Because if I just hand you a cucumber or a rutabaga and say, here, go be healthy, that's not going to do much if you don't know what to do with it next. If you just look at it and say, I don't even want to scrape the dirt off this, I'm just going to chuck it in the trash, you haven't done anything. So having that different approach of along with people instead of here, you go do this, is what we're trying to do there. With the parish nurse program, the idea of getting people who are vulnerable. So those of you who go to church, you've got a section in your bulletin every week that says, please pray for the sick. Okay, I think we can do more than pray for them. I think we can go along with them. We can help visit them. We can help make sure they have their medications. And some of these nurses who are retired can go along with their parishioners or with their congregation members to the doctor's appointment if their daughter lives in Dallas or Cincinnati or something, and say, here's what the doctor meant when he said this. And I think that's really key to helping people understand their own health conditions. And just a little cue, I actually did some of this presentation in Seattle at an American Hospital Association meeting. I made sure and brought all these gorgeous pictures of St. Genevieve so people would be jealous of where I came from. And then walkable community, cleaning up and getting new sidewalks all around town is one of the things that the city is doing in particular. And being able to walk around the community and see all the historic places and all the shops is really important. And we're even doing that on our hospital campus. And so we're installing these safer crossing guards, the lights with the help from the city. And then this little thing, I love this thing because it's just a notice of, hey, there are people walking here. Drive by that. See how many times it's been run over. I don't think it's just on Cataract Day. I think people are just not paying attention sometimes. So those are some of the practical things that we've done since our last community assessment, and we take it seriously, and we're trying to make the best of what we have. So if we want to do this going forward, we need to establish a facilitator and have people volunteer to participate in this. Participate in settings for improvement, involve yourself, your company, your agency, your connections in the initiatives, and then help during reevaluations and new initiatives. And I know that's really quick, but I know time is tight in here, and I'll happily send this out for you to digest this slide deck further. I'd be happy to talk with you more about this after the session is over. So any questions right now? All right, thank you very much for letting me share this.
Maybe in January on the agenda, we can put that as an item if we want to develop that working group. And of course, everything here is always volunteer basis. So maybe those of you that are inspired by that presentation, start thinking about that if you would have time next year to work on those things alongside with the hospital and other partners in here.
Okay, moving on. This is the 30th anniversary of this organization. I think we have one person here from the original group. Is that right?
Yes, so we invited a few folks to join us today, and we only had one that was able to make it, and that's really all we need. Because she is one of the founding members, and she can go all the way back and talk to us a little bit about what it looked like when it was first started. So I'm going to give her a few minutes to kind of share with us her experience with the forum, and then I have an article that I'm going to submit to the paper about the forum that I would like to read out to you guys. Yes, please. It's Judy Shilley, and I believe she was director of the health department here for St. Genevieve County at the time.
Well, going back 30 years, we were just coming out of a big flood in '93, and I had so much work, and a few of us were already talking about there are things going on in this community we need to address. And one of the biggies at the time was pregnant teens. And people are slightly more able to accept the fact their precious little girl got pregnant without marriage these days. Back then, a lot of parents, you're out of my house, I'm done with you. Get out of here. What's a 15, 16-year-old going to do? And usually a grandmother or an aunt or a close friend would take them in, but they had no guidance. Here they were, 15, pregnant, no money, don't know anything really. And we kept saying, we were seeing them in our WIC program, and they didn't know anything about diet. You know, they lived on candy and soda. They didn't know anything about this. We needed somebody to take over as their mom. And where are you going to find that? And so it was me. At that time, the health department was down in the old county services building that was recently demolished. We had part of the building, the extension office had part of it, and Tish Johnson was there at the time. And I don't know, I think Tish and Jean Ressover had coffee one morning, and they brought this up, that Tish and I had talked about this. And, well, Jean was very interested. She was the editor of the newspaper at the time. So we got together for coffee one day, chit-chatting, and, you know, it sure would be great if we could get some money to pay someone to be the surrogate mother of these pregnant teens. And like Dr. Poplar said, our community is not that poor compared to others, so it's difficult getting grants. So we would meet periodically and talk about it, and finally we started to have a little bit more organized meetings with others in the community, like from family services. I think we had a minister come. I'm trying to think back 30 years, I can't remember anymore. We would meet at noon because we did this and we weren't doing our real jobs. Now all we had was 30 minutes of lunch, some of us. And well, like I said, I was still working with the flood business. I was running wild. I didn't know what I was doing half the time. And so I was usually late for meetings. And you were one of the early members, weren't you?
I've been in the forum for about 22 years.
Well, okay, you were in the beginning. I can't remember who was really in the very beginning. There were like maybe 6 of us at the max.
Was it Diane Weber and Vicki Brookerhoff?
Yes.
Because they started the Young Mothers group.
Yes, and well,
Or like they
worked with it.
Yeah.
Marianne Doherty.
Yes, she did, I'm sorry.
She was the first one.
She was the first.
And oh, God bless us her. Because she wouldn't take anything off anybody if she thought she was right. And she would sit right there and she'd tell you why she was right until you blinked her. And she was so good with these girls. She would meet in the evening after they got off school and just go back to basics. I mean, some of these poor girls, they might be 16, but when it came to understanding their bodies, the pregnancy process, babies, having to be fed, change their diaper, bathe them. They didn't know anything about that. Nobody was there to teach them. And I'm not sure how we got the money to begin with in the very beginning. I'm thinking the hospital helped us out quite a lot, to be honest, because eventually Marianne did accept a position with the hospital in the education department, but she continued with these girls. And she was a surrogate mom to them. And if any of you have teenage girls, you know how difficult that can be at times. Sometimes she would literally go out on the streets and find these girls and say, hey, you had a doctor's appointment, did you? Oh, I forgot. You better believe they had another appointment and she went with them. And I don't know if you all still do that in the Young Mother Support Group. I'm just thrilled to know you have a group going yet, because that was our first baby. And then we said, you know, we need to get more organized. We need to have a way to become a 501c3 and become eligible for more grants in different areas. And one day I was late for a meeting. I was at City Hall or something. They came flying in about half an hour late. And I thought I sneaked in and sat down, and they stopped the meeting and they looked at me and said, "Judy, there's something we need to know. We just had election of officers. You're president." Thanks. And I said, also, we decided we need that 501c3, we need to be incorporated, you need to do that paperwork. Oh, well, I couldn't. I tried. I looked at that massive paperwork and I work on it for 15, 20 minutes at a time. And I do not remember the man's name, but he worked with the extension office. He knew how to write one up, and he did it up. He fixed all the paperwork. I signed off on it, sent it in, and we were incorporated, or we had our 501c3, and that's how it got started. And then once we got people, I said, you weren't with Life then. You were
East Missouri Action
East Missouri Action Agency. Well, her main office was in St. Francis County, but I mean, you had an office here at that time, but your boss was over there, right? So she was coming in from another county, and she'd go back and she'd talk about this community services form. And I started getting phone calls from different people in other areas. What is this? How do you get people to come? They won't come. I tried to start this, and I said, well, it started slowly, but we're getting more and more people interested. County commissioners started coming, hospitals started coming, just people, insurance agents for a while would come in just because they wanted to know what was going on in the community. And that's basically how we got started. It was an informational group to begin with, and we shared a lot. And you know, if we were doing something at the health department and we needed a little bit of help, well, hey, I can come over and I can at least direct traffic for you. And then, okay, if you're doing something, let us know, we'll help you. And that's how it really got started, and I'm just delighted to see how you folks have continued it after all these years. And so many attending. If we had half this many at a meeting, I don't think we ever did 30 years ago.
No.
So I'm just really proud of all of you continuing this and sharing with each other. That's what's so important. Because if you know what your partner in the community is doing, sometimes you can help them in the funniest ways. I know we've helped each other. Hey, you're not going to believe this, but I think I can get somebody to help you with that. And we've never known that before without this. So thank you for continuing it. Makes me feel really good. And I know Tish and Mary Ann would have loved to have been here. And they would have talked your arms off. I won't. I will let you go on that. We were all very proud of you.
Thank you.
Thank you. Thank you.
Alright, well, we're probably gonna have to update this since we have a little bit more background on the origins, but I would like to assure you that that is still what we do here, is we come together and we share what we're doing, and as you mentioned, we help each other in the most, unexpected ways. And
Very unexpected.
so that legacy continues on. And I'm incredibly proud to have been able to develop this forum over the past 3 years. I think I'm into year 3 of being the coalition contact and lead. So it's come in waves. We have a really great group for the most part. This is what you see at the table here. Okay, so I won't read this to you just because we're going to have to update it. What I would like for you to know and everyone else to know in here is that we look different than what it looked like back in the day, and that's really what these community coalition groups should do over time, is evolve. Currently, we do the prescription drug takebacks, and we also do what's the other one? The Young Mother Support Group, the Domestic Violence Division, the Resources to Recovery. And then I don't know if we're gonna continue doing the career fair. I haven't heard from the folks that we partner with on that. And of course, the Adopt a Family program, which we are in the middle of. So thank you all for being here. I am gonna have to leave at 1 o'clock for another meeting. Could someone volunteer to take notes on the individual member reports? Anyone? Sure, thank you. So it'll just be the individual member reports. So that is our recognition to the 30 years of the Community Services Forum for our community here in St. Genevieve County. Okay, and so I guess that's, unless anyone else has anything to add, anybody that's been here for a long time?
I heard you were.
Been here 12 years.
Oh.
So, whatever I took over my job. One thing on that topic is our dues are starting in February. The applications at the door. Appreciated. That's part of the money that keep the project going and help pay for our lunches. Okay. We'll go right into individual reports here.
Actually, before we go into that, I do need to add one additional item I didn't mention earlier.
You're not on the agenda.
I'm sorry. I'm so sorry. I don't tend to veer off.
We just bumped the announcements up earlier.
Yeah, we're gonna have to bump the announcements up early because I have to step out at 1. I don't have an option to not. So because I left Extension and I'm no longer really headquartered here and just kind of in my coverage area. Jody was the treasurer for maybe a year and a half, not too long, and she is choosing to step down from that role since we don't have that relationship that we once had when I was in the office here. So there will be a treasurer's position open for anyone that might be interested in taking that on. She, and correct me if I'm wrong, has agreed to help out during the tax season, which is probably the most difficult time when it comes to the treasurer's role. It's just making sure that everything that she handled for year 2023 is in order, so when it goes to, is it Harrell, with HSB Advisors to do our tax requirements, that she is still there to assist with that. So anybody would like to be treasurer, we only have the greatest expense in tracking is this lunch that we provide here, collecting the receipts and then just managing that account, making sure everything is good. So just think about it. We don't have a meeting in December, so we have until January, hopefully, to find someone that would be interested in doing that.
Okay. Please consider that somebody. If you have any questions between now and then, I'm sure Jody will.
Just stop by the extension office, I can talk you through.
Okay? Now we'll go to individual report. I'll start off with 911 and emergency management. The only thing we got going is radio upgrades. There's been a few hiccups on tire locations, but we're moving on. So.
I don't have anything.
I just wanted to add with domestic violence that I'm a local person and that I can tell people what happens, like when they call a certain number or options that happens when they do stuff. So that's one thing that I offer, and there's nothing else in St. Genevieve for domestic violence. So anyway.
Cindy Lewis, Country Mart Pharmacy, healthcare worker, and nothing new to report.
Shanna Sword, University of Missouri Extension Community Health Field Specialist, and My role recently changed. I did attend these meetings a few times over the last few years, and I had pretty much been focused on the prevention, substance use prevention, and now my role is expanding to a bigger community health umbrella, and St. Jen is officially a county and my service. So, nice to see everyone. Thanks for having me.
Robin Reynolds, I'm the facilitator for the Young Mother Support Group. Last month, I could not attend the meeting, as I had said, but didn't y'all meet at the park? My mom's met at the park and just kind of hung out so that we didn't have to cancel the meeting. This month, we are meeting a week early. We're meeting next Tuesday. Do we have a speaker, Crystal? We have a speaker. Crystal arranges all of our speakers now, so we do have a speaker for our next meeting. Looking forward to that. That's what we got going on right now, and then in December will be our Christmas party. So, and then as far as the Life Center, we have partnered with the school again this year to do the Thanksgiving food drive. I already have a list of names, so we're hoping that we get a good amount of donations. We always do. The school always pulls through for us and gets us a lot of food for that. So we usually deliver to a lot of seniors, disabled, and veterans. So we're really excited to be able to deliver Thanksgiving baskets this year. We are still really busy putting ramps in, delivering equipment. It is the middle of Medicare season, so I'm about to pull my hair out with that. And the only other thing we got going on is December 7th, we will be cooking Christmas dinner for about 500 of our consumers. That's all of our catchment area, St. Francis, St. Jen, and Madison County, and then we deliver all 500 of those meals to all of our consumers. So that's a pretty big endeavor that we take out for them, but we're excited. We love doing it for them. So that's all we have going on.
I'm Kathy Willis-Reed, and I work with Aging Matters. I'm the Family Caregiver Support Program Director. Right now at the agency, because we have a lot of other services besides just the one that I work with, our INA team is in the middle of Med-D enrollment, and so I hear a lot about that. One of the things that we're looking at from the agency is we've got a senior growth and development fund that's new funding for us that's come in quite a large amount, so we're looking at creating some new services. One of those that I'll be working with is child care for people who are 60 and older and who are doing kinship care. So that's grandparents, aunts, uncles, as long as that somebody in that equation is 60 or older. We don't know how that's going to roll out yet. It's brand new. We're hoping to have it up and running by February. But if anybody works with kiddos and wants to share some resources or services or information, please talk to me, because, like I said, I'm not sure exactly how it'll roll out. But, you know, we're going to need to use some of the services that are already in place to make that effective. That's pretty much all I have right now.
My name is Kendra Graham. I work with University of Missouri Extension as an engagement specialist. So Extension is predominantly an education resource, as broad as the sky, on topics. And so some of the topics don't necessarily apply, but our goal aligns pretty well with this coalition is trying to keep our community healthy. And so we do a lot of education, a lot for prevention, and maintaining that health. One of those programs, Katie Kamler, our horticulture specialist here in St. Jen, has a program with the Master Gardeners, St. Jen Master Gardeners, on vegetable and flower gardening. And so we all know that proper nutrition helps prevent a lot of our health issues. So that's November 28th at 6 o'clock right here in the sports complex, if you're interested in that. We also try to help with farm mental health. And so we have a farm tax workshop coming up for farmers and ranchers to explain some of the tax codes that are happening. That is also here at the Progress Sports Complex from 1 to 3:30 on December 13th. So if you have questions on those, please let us know. That's all I have.
I'm Janet Ron. I'm the 4-H youth specialist for St. Genevieve, St. Francis, and Washington counties. We're right in the middle of our enrollment right now, so if you know any kids aged 5 to 18, why they are welcome to join 4-H. Two of the programs I wanted to bring up, they do a food drive every year. This will be our 6th year. And we do it kind of as a little competition between the clubs and which club can collect the most food or funds. Then it all stays local. It goes to the local food pantries here. I don't have the totals of what we did in this county, but as a state, last year they collected 700,000 meals. And over the 5 years, it was 1.7 million meals that the 4-Hers have collected towards food insecurity. And then another program we have coming up in February is Move Across Missouri, and we encourage the kids to do a little competitive staying active. So for 12 weeks, they record anything that they do as far as it can include recess, sports, and then they kind of upped the program this year, and the kids will get prizes for how many hours or minutes that they're active. So
Is that February?
yeah, it starts in February. Yeah, it'll go for 12 weeks. So that's what I got.
My name is Terry Westridge. I'm with Southeast Behavioral Hospital out of Cape Girardeau. We work inpatient and outpatient services for individuals with mental health issues. And really for us, we've just continued to expand our services for youth. We're seeing kids, as I mentioned before, in 6 years old. You see adults, seniors, but it seems like most of what we've been seeing lately has been youth. So continue to work with the different agencies throughout the area, and we do have beds available. We've had kids that are staying a little bit longer because we work with a lot of kids in the foster system, and it's very difficult to find foster care, foster families and things. So we don't kick anybody out. We keep them as long as we need to, as long as they need help. So that's kind of where we are. It's kind of, I guess, our latest updates.
I'm Karen Sippy, the First District Commissioner with St. John County. We did a road assessment yesterday. We just kind of went out and looked at some of the roads and what we feel like, could possibly be done for next year budget-wise. We also are probably getting ready to start working on the budgets in December. We were awarded a flat grant last year, and construction on that is probably on the 4th Street Bridge looking at 2025. We also were awarded a BRO grant to replace the Franklin Bridge down in St. Mary. We were also awarded a TAP grant to replace the sidewalks around the courthouse, and also do a new sidewalk basically from Pettis Ford on Highway 61 over to First State Community Bank. We've been having some work done around the courthouse. We had some critters in the courthouse, and we had some remediation done in the courthouse, in the Art Guild building, the old museum, and the chamber. So those critters were removed safely, and we've had all of those areas sealed up and secure so that we don't get any more birds or squirrels or things like that coming in our buildings. Also, we're working on getting new gutters put on the Art Guild building and the chamber, and then we also had some repair work done to the courthouse gutters. I know I'm forgetting some things. I have some things written down, but those are just a few things that we're working on, but I'm sure Randy can pick up on what I missed.
I think you pretty well covered it. I mean, and then there's just the normal day-to-day stuff that somehow we go, what does the commissioner do? After, these meetings. Yeah, Karen pretty well covered it. Just as she said, we're working on budgets, which will be in January, but we're getting ready to get ready. overall, there's been a downturn in sales tax revenues, and there's any number of reasons that we can point to that. It's been flat this year. So we're looking at ways to tighten the belt. I don't think it's going to be horrible, but it's definitely not going up. It's leveled off. One of the things, in case you don't know, is we lost the Wazora truck stop. The company that had bought it earlier in the year went into Chapter 11, and then ended up in Chapter 7, completely bankrupt. They had filed to pay their taxes annually, which is something I didn't know you could even do, which meant that all the taxes for this year we wouldn't have seen till next year, and now they're bankrupt, which means we will probably never see them. Surprise! We've heard rumors that it's been bought. We don't know. It's in a TIF area. There was a TIF with the previous owner who never really fulfilled his obligations. The owner that just went bankrupt wasn't fulfilling the obligations, so we're looking into what we can do legally to dissolve that. That's not good. Everything else is just kind of holding steady. So, like I said, Karen covered most of it. That's all I have. Sorry.
My name's Michelle Ramsey, and Crystal invited me to join today. I am the Community Counseling Center Foundation Executive Director, and obviously, Community Counseling Center, we cover 5 counties, St. John being one of those. And I recently hired a development coordinator, and now am able to get out and start visiting some of our counties and trying to build some relationships. The foundation primarily exists to support the work done by the Community Counseling Center, fill in gaps for things that aren't covered in funding. And last year, well, I guess this year, in May, for Mental Health Awareness Month, I kind of took on something that really grew bigger than I expected it to, faster than I expected it to. And so now I am working on putting together a team of people that would like to help collaborate and further our goal. I ended up getting the Bill Emerson Bridge lit green for the month of May, and that was not an easy task because I dealt with lots of different entities to do that. And at the same time, we had a campaign that we were putting out there with green flags that said we support Mental Health Awareness Month, and I would love to see that further in all 5 of the counties that we serve. And I would really love to have some people that would like to be involved in helping make that happen. And you know, it can be law enforcement, fire departments. I mean, we had a lot of participation with the city of Cape because that's where I was at when I started. But I would love to see that campaign go further and bigger, and I'd love to have a landmark in each of the 5 counties that we serve more if people wanted to join. So if anyone is interested in joining with that, please see me or get with Crystal. I signed in, so if that email goes out, my email's on there, again, my name's Michelle Ramsey. But I would love to work with you, and we'll start putting a plan together so that we can all kind of move in the same direction.
What's the campaign again?
It's for Mental Health Awareness Month in May, but to get everything done, you gotta start now.
Billy Hansel, Parkwood Meadows Administrator. I don't really think new this month. Just getting ready for the holidays.
I'm Crystal Lyerla, I'm the PR, you're good girl. I'm the PR and Marketing Director for the Community Counseling Center. I just wanted to update that St. John CCC facilities are still undergoing the remodels here. They are expected to be done at the first of the year. I also wanted to publicly thank Happy. I don't know if everybody saw our suicide prevention awareness display of the pinwheels at MRV Bank. But Happy actually led us to that great location. So we were able to have those up over that weekend period. And I thought it turned out, I mean, unfortunately, it was unfortunate we had to have that, but it was a good visual representation of how suicide affects our communities. Other than that, we're going to be having a campaign come out, airing on KFPS 12, about seasonal affective disorder, which is and seasonal depression. depression. That is something that starts kicking in about this time of year. So some of the things they recommend are, just making sure you're getting adequate sunlight, either artificial or natural, eating healthy, which plays into everything, a lot of things you guys focus on. It's definitely a big thing, getting enough rest, that type of thing. But just here shortly, I approved the commercial this morning, so hopefully you'll be seeing that air on KFDS 12 over the next 2 months. We've got 2 or 3 that are going to be in rotation. And just check on your friends, as always. So that's all I have.
I'm Hank Velker. I'm with the Missouri State Emergency Management Agency. I'm a regional coordinator for this area, 7 counties, St. John included. I didn't have much to report on, but I just put 1 and 2 together and realized this organization's been going on for 30 years, and it was sparked from the 93 flood. So 30 years later from the 1993 flood, the State of Missouri Emergency Management Agency, just last week, we have finally purchased our first sandbagging machine. I am now trained on how to operate that piece of equipment. It's about the size of these tables put together, and I can honestly say it forks out sandbags as fast as the sand will fall. So the river's cooperating right now. Actually, it could probably use a little up, but the next flood, yeah, we could get a sandbag machine.
Find the legislature for the sandbag machine.
You can thank them for that, yeah. And it was not cheap. I don't know if I'm allowed to say how much it was, but obviously it's public record. It was pretty expensive. Yes, sir.
Happy Walsh from City of St. Genevieve. Our City Hall remodel is on time. We're looking at moving back in the middle of February. In between time, we have pulled out our drop box, the nighttime drop box for utility bills. So probably cause a lot of concern, but we're putting a new one in, so for the temporary time, we don't have the drop box available. But we hope to get that fixed here shortly, but we should be back in our regular place in February. That's all I got.
I'm Jamie Drury. I'm the Director of Student Services at St. Genevieve County R2 School District and the current president of the St. John Rotary Club. From the school, today is actually Parents as Teachers Day. So we're celebrating our parents as teachers, our parent educators today. They do a wonderful job supporting our families. In December, we are going to send 4 early childhood special ed paraprofessionals to receive training on how to screen for our Parents as Teachers program. That will allow our parent educators more time to dedicate to families. So we'll have more people that can do some screenings. So if you guys have any questions or need parents as teachers within your organizations, give myself or Bethany Kenning a call.
Hey y'all, I'm Tiffany Aiello. I'm with the Shepherd Catholic Charities, and I'm the Pregnancy and Parenting Support Worker for St. Jan, St. Francis, Washington, and Perry counties. And I don't have any updates. We've got lots of openings still.
Robert Scott, Adult Education at GPD. The only announcement that we have is we're currently looking for a new adult education teacher for St. Genevieve. My last day will be December, and all the requirements are right now is bachelor's degree, and it's about 6 hours a week. So if anybody's interested, please let me know or contact Stacy Snyder. Thank you.
I'm Dan Alfaro, and I am the Veterans Representative for the Job Center. The Job Centers are there to serve all of our citizens as well as our businesses, and everything that we do is free of charge because we are funded by your tax dollars as well as grants from the federal government. So I encourage everyone, if you have a business or if you know someone that needs help finding a job, use the services through the Job Center. We can help businesses to get their positions filled. We can help people to find employment. In my particular job, my focus is on veterans with disabilities and other barriers to employment. I help them get back into the workforce and find good jobs. That's it in a nutshell. It's much bigger than it sounds, but that's the easiest way to explain it. And there's a few programs going on I'd like to talk about real quick. One is the Mo Heroes Connect. Under this program, we can pay to set up OJT opportunities with employers, and we can pay for supportive services as well for service members who have served up to at least 6 months on active duty within the last 5 years. And this also extends to the service members' spouses as well. And the reason I want to make sure everybody knows about this program is the Perryville National Guard unit is currently deployed. I'm not sure exactly how long they've been gone, but I think they're creeping up on 6 months. So once they've been on those Title X orders for 6 months, their spouses back here are eligible for this program, if need be. So say they're still gone wherever they're at, and their wife's back here taking care of the kids and keeping the home running, and the well goes out, or the hot water heater goes out, and she doesn't have the extra funds to get that fixed. They can come through the Job Center, and as a supportive service, we can help with the funding to get those things fixed for them. So I want to make sure that the community is aware of that in case one of those emergencies pops up. We also have a couple of grants going through the Job Center, and these are for everyone, not just veterans. The first one is the EDA Good Jobs Challenge Grant, and this is to help pay for training for careers in education, healthcare, and logistics fields. This grant is currently on pause, but we're hoping they're going to open it back up again in about a week. We started at the end of September with it, and in the month of October alone, in the Southeast region, that's Park Hills, Cape Girardeau, and Kennett Job Centers, we enrolled over 70 people, and the bean counters up in Jeff City kind of freaked out, and they want to make sure they know where we're at financially before we enroll anyone else, because there is limited funds for that grant. The other one is called the Quest Grant, and it's just coming online, and this one is specifically for supportive services for people who might be in college in certain industries, and I'm not the expert on this one yet. So if you know someone who's in training for a career and they're needing help, have them get a hold of their nearest job center to see if they qualify. And our number is in the community resource guide here. Your closest job center, the one that actually serves St. Genevieve County, is in Park Hills. Your next closest would either be Cape Girardeau or Arnold. I think Cape's probably the closer one, unless you just happen to go towards St. Louis a lot. And that's all I got.
Hi, I'm Crystal Sugar from the Health Department, the breastfeeding peer counselor. Nothing exciting.
Hi, I'm Sarah Drost. I'm with the St. Vincent de Paul Society here in St. Genevieve, and we're currently needing a new president. So if you know any good Catholics with a lot of time on their hands who are good with computers, I would love to speak with them. So that's kind of my thing. It is quite a, I will say it's a, you need the time to be able to do this. So like if you have a retired friend maybe. Anyway, that's, yes, please. I can give you all the job details if you need. But we do need someone to fill that position.
Yeah, I'm Mary Blackler, Community Outreach Coordinator for St. John Hospital, and I have nothing to report.
I'm Jody Ralston, I'm with MU Extension, I have nothing to report.
We already met the announcement, was that right? No December meeting. Next meeting is January 10th, 24. Okay. If nothing else, make a motion to adjourn. Mary, second.
I'll second.
Karen, all in favor? Aye. See you in January.